Okay, so we're going to be talking about nematodes. And what are nematodes?
Roundworm.
Roundworms, yep. And I always remembered Nema is round. If your name is Nema, I feel really bad, and I take that back. So here's your overall nematodes. You're going to have intestinal nematodes, and then you're going to have tissue nematodes. So your intestinal nematodes are going to be your Enterobius vermicularis, your Trichuris trichuria, Ascaris lumbricoides, Ankylostoma duodenale, and Nematode americanus. And if you say these differently than I do, that's perfectly fine. I'm sure someone went to school long enough to know the exact names, but if you can tell what it is and attempt really hard to say it right, then I think you'll be good. Strongyloides stercocalis, Trinchinella spiralis, and Draculus medanesis are all intestinal nematodes. And then you've got tissue nematodes, which are your Rucheria bancrofti and your Loa loa. So they're all nematodes, but some of them are intestinal and some of them are tissue. And so for Enterobius vermicularis, it's going to be your pinworm. Your infective stage is the embryonated ovum. Your method of infection is ingestion, anal scratching, and then touching the mouth. So what the Enterobius vermicularis does is most just reproduce in the system that they're in. So in this case, like the intestinal system. But the female, the gravid Enterobius vermicularis, gravid means pregnant, will go and travel to the perianal region. So like right outside your butthole pretty much, and will lay her eggs. And so the method of infection is, and it's more common in children, and that's because children will scratch their butts and then go and touch their faces. And so the method of infection is ingestion. So anal scratching and then touching the mouth is the main one. Diseases and symptoms, you'll have perianal itching, which is called pruritus Annie. So pruritus Annie is the itching of the anal region, and it's the most common helminth. So what's a helminth?
Helminths are worms.
Worms, yep. So this is the most common worm overall. The method of diagnosis is a cellophane tape prep, and your key characteristics, the ova are jelly bean or C-shaped, with thin outer shells and colorless. So I'll come down.
Which is the most common, you said?
Enterobius vermicularis. Enterobius vermicularis. Okay, so I'll start with, it's an intestinal nematode. And actually, I'll put that one down here. I think the main one to know. What's the common name for it? Enterobius vermicularis?
Pinworm.
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 So your Enterobius vermicularis is a pinworm. It is an intestinal nematode. The infective stage is going to be your embryonated ova. And the note I put for that, out of remembering the infective stage for these nematodes, is ETA. Let me put that down here. ETA, which is your infective stage or embryonated ova, which means Enterobius, your E, and then your Trichuris, which is your T, and then your Ascaris is your A. And so those are all the ones out of these nematodes that have the infective stage as an embryonated ova, and then the other ones are different. So ETA is going to be your embryonated ova. And then your method of injection, method of infection is going to be ingestion. And specifically for this one is going to be anal scratching. And touching mouth. Your diseases or symptoms are going to be perianal itching. And if that's not a question on your exam, I will be very surprised. It is the most common helminth. And then your diagnosis is going to be the cellophane tape prep. Did y'all learn about that? Cellophane tape prep. So the cellophane tape prep, how that works is you simply
They take a tape to the anus.
Exactly. Yep. They just take a piece of tape and stick it to their perianal region and wait for overnight because that's when this gravid pinworm will migrate is generally nocturnally, and so I've always learned always nocturnally, but you know you've always got that one crazy scenario. But overnight, you leave the cellophane tape over the perianal region, and then you take it off in the morning and check it for eggs. So if it has little eggs on it, then you know you're positive for Enterobius vermicularis. So most things that you're going to identify by ova in the stool sample. So that's something that's special about Enterobius vermicularis is that it is not diagnosed by a stool sample. It is diagnosed by the cellophane tape prep. And then for key identification characteristics, it's mostly just going to be the ova.
For what now?
Under your key identification key characteristics, sometimes you'll have key characteristics of the worm, sometimes of the worm and the ova, sometimes a infertile versus fertile egg, sometimes a rhabditiform larva, sometimes a filariform larva. But for this one specifically, it's just the ova. And they are jelly bean or C-shaped with a thin outer shell and colorless. And I will show y'all a picture. That side. There we go. So see, it's got like kind of like the little jelly bean shape here, and then it's more colorless compared to some of the other ones you'll see, and it has a real thin outer membrane. So this shell here is real thin, those darker lines. And that's going to be your pinworm.
So on all of these, do we need to know what it looks like at 10 and 40 on all of these?
I like it on there mostly because that's what I'm going to be doing in the field.
Okay.
But a lot of the times, even in the field, they will have specialized people looking for these parasites because they're so hard to see. So your big things for Enterobius vermicularis or pinworm, perianal itching with the cellophane tape prep. So that means it's not a stool sample, and that it's the most common helmet, and then it's common in children and has a jelly bean shape.
So it has a thin outer shell, but then the book says it has like a thick wall. Like what?
Yes.
The picture
Let me
is
show you the
the
difference.
difference.
Okay, so see this this black part right there? The dark part is the thin outer shell, and then the wall is this like empty part before you actually see the little embryo. So see that embryo right there? And see how there's a big gap between that dark shell, that thin shell, and the actual embryo? That's that wall compared to like, let me find a different one.
Okay, yeah, like the whipworm, I see like just the difference between the two there.
Yes, so like here's one where it's got a shell, but it's not as thick of a wall right there. Doesn't really look like a wall. See here, it's super thin. It's close from the embryo to the outer shell, compared to this one having that much space between the embryo and the outer shell.
Okay.
And then what generation is it common in? Is it common in adults and children and immunocompromised?
Children.
Children. Common in children, and I want to say children under 5, but I think children in general is a good enough way to know that. So that's Enterobius vermicularis.